Sinha. Former Punjab Chief Minister Amarinder Singh on Wednesday said he will never allow Sidhu to become the Chief Minister of Punjab, as Charanjit Singh Channi's appointment as the Chief Minister has only widened the road for Punjab Congress President Navjot Singh Sidhu to become the Chief Minister face in upcoming elections. The senior Congress leader said he will pit a strong candidate against Sidhu so that he cannot become the Chief Minister, triggering speculation over captions for the political plans. As Amarinder Singh resigned on Saturday amid the ongoing party infighting, he revealed how much humiliated he felt because of the latest development in the party. He felt hurt that the party high command started losing trust in him. The Congress Legislative Party meeting was called on Sunday to decide an Amarinder Singh replacement without his knowledge. Before the meeting, Amarinder Singh went to the governor's house and resigned. He said he had informed the decision to the party president Sonia Gandhi on Saturday morning. On Wednesday, 2 days after Charanjit Singh Channi took oath as the new Chief Minister of the poll-bound state, Amarinder Singh said that he had offered the resign 3 weeks ago, but at the time he was asked to continue. If she had called me and asked me to step down, I have done. As a soldier, I know how to do my task and leave once called back, Singh said. Taking a serious note of COVID-19 deaths of government teachers in Kottagudem district and 71 school students from across the state becoming asymptomatic coronavirus cases, the Telangana High Court on Wednesday asked the state government to complete vaccination of all teaching and non-teaching staff in school within 2 months. All government schools and some private institutions have commenced physical classes as per your own details, yet vaccination has not been administered to the all 4.9 lakh teaching and non-teaching staff. There is an impending need to vaccinate the remaining staff. As children interact with them, there is a possibility that they would get infected. Though children are asymptomatic, they will be carried to their houses, which may lead to community spread. Hence, this court wants to completion of vaccination process to teaching and non-teaching staff with 2 months. A division bench comprising Acting Chief Justice M.S. Ramachandra and Justice T. Vinod Kumar was dealing with the PILs related to the COVID-19 management in the state. The bench directed to the government to ramp up RT-PCR testing as there has been a steep decline in the test. In the last 24 hours, Odisha has recorded 644 new COVID-19 cases, of which 72 are in the age group of newborn to 18 years, taking total tally in the state to 10,22,594 active case load in the state, who now stand at 5,713. Out of the 644 new infections, 375 were reported from the quarantine center, while 269 persons contracted the virus locally. The state had registered 734 cases of coronavirus infection Wednesday. Khurda district registered the higher number of new cases, with the 283 persons testing positive for the diseases. It was followed by Cuttack with 77 new infections. The state poll reported 67 new cases. These are persons who have come from outside Odisha and have tested positive. The total of 1,95,17,845 swab samples have been cumulatively tested so far. The number of recoveries in the last 24 hours stands at 445. A terrorist was killed in an encounter with security forces in Sofian of Jammu and Kashmir on Thursday. Security forces launched a cordon and search operation in Khashwa village in Zoinapora area of the district following information about the presence of militants there. They say the search operation turned into an encounter after militants opened fire towards the security forces, drawing retaliation. 1 terrorist have been killed so far, officially told news agencies, adding the operation was in progress. The identity and group affiliation of the killed terrorist was not immediately known. Earlier, terrorists on Wednesday fired up on civil at the Chitrangam Kalan area of Sofian. Police identified the civilian as Zamir Ahmad Bhatt, who is shopkeeper of professional and resident of Dangarpora, Chitrangam, Kalan. According to the police, Bhatt received gunshot injury in his leg and was rushed to the nearby hospital to the treatment, where his condition said to be stable. Lucknow with over 150 cases of dengue reported in September. The total number of cases this year crossed the 230 mark in Lucknow, with experts saying that the next 15 days were crucial. Uttar Pradesh has reported at least 4,500 cases of dengue this year, and patients with fever are continuing to throng OPDs of different hospitals. This year dengue has struck earlier than usual, and the period till October 15 is so cruel. Hence, we need to continue preventive activities, said Dr. Advesh Kumar Yadav, Joint Director in the State Health Department. Dengue and viral fever showed symptoms such as sudden onset of fever, malaise and throat pain. These were almost common and hard to differentiate, said Professor Kausar Usman, Geriatric Medicine at the King George's Medical University. September has been crucially, with majority of dengue cases reported in this month, as extended rain continue in the region that the throw of mosquito breeding remains, with the stagnant water in unused items such as old tires, broken cups and empty cans. That's it from me and my team. For more updates, keep watching Crazy News.